Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on causes of neonatal physiological jaundice. The important one is immature liver. As a baby is born, liver is not mature, it is not fully active. The enzymes responsible for detoxification are not fully formed. That's the reason these toxic materials become increased in the blood. Next one is when the baby is born immaturely before the completion of the months. It is also one of the risk factors because their liver is more immature compared to the mature delivery. Normally, the lifespan of RBC is only 90 days in kids. That's the reason after 90 days they will be destroyed. As the RBC has low lifespan, more RBC will be frequently destroyed in the spleen and releases more toxic material that cannot be eliminated from the kid's body. Compared to adults, kids will have more RBC because they do not have direct access to the oxygen in the air. They have to take the oxygen which is there in the mother's blood. It means their circulatory system or their oxygen diffusion system should be more potent than their mother. That's the reason the number of RBC or the red blood corpuscles present in the fetus are more than compared to the mother's blood, so that they can be efficient. All these causes leads to higher RBC in kids and also with low lifespan and low maturity of the liver. That's the reason all these toxins get accumulated in the eyes and in the skin.
Fidicus Homeopathy.